So cartilage injury, what does that mean? Well, cartilage is the soft tissue in the knee. So, well, it's really in all your joints, but in the knee, we refer to it as the articular cartilage, which is the cartilage that caps the end of the bone. If you think about the knee as a hinge, you have the cap on the bottom of on top of the leg bone and at the bottom of the thigh bone, and that's the articular cartilage. So that can get injured. And then you also have the cartilage that sits like a washer or a gasket in between the joint, and that's called the meniscus. And you can actually have tears in either one of them. When you tear the articular cartilage, it's usually a direct blow or could be chronic overuse, anything that can cause this stuff to kind of flap or fibrillate, which means it kind of breaks into little pieces, and that can be painful. That is actually really early knee arthritis. And then you have the meniscal tears, and usually that is a squat and a twist. It could be an athletic injury. It can occur in adolescence, and it can occur all the way up in 50, 60, 70-year-olds. Typically those older patients that get a meniscal tear, those are more of a degenerative tear, and the younger patients that get a meniscus tear are typically traumatic tears. So how do we treat those? Typically those are treated arthroscopically where we put a hole in the knee and we look through a camera, and then we put other holes in the knee and we work and we can sew it back together or clean it up if that's what it needs. We can also try other things like physical therapy. Rarely we'll try injection therapy for a meniscal tear. But for cartilage tear, it's typically avoiding activities that hurt. You don't want to try to work your way through it if that's what happened to you or what's going on.